So good afternoon. My name is Lauren Lele. I am the Senior Director of Community Health and Volunteer Services at Newton-Wellesley Hospital. And we are so glad that you have decided to join us this afternoon for today's programming titled Aging in Place, What Does It Mean to You? This is the first in our four-part series, the second of which will be offered next week on Thursday, June 20th at noon. And all these sessions are being hosted by Newton-Wellesley Hospital Community Health. Newton-Wellesley Hospital Community Health is dedicated to improving the health and wellness of those who live in the area that we serve and focuses on addressing health and socioeconomic needs by enhancing medical services and resources throughout the community. Through initiatives that include access to health care, prevention, and intervention, the hospital is making a difference in the cities and towns in which we live and work. A significant part of these efforts is through 8 councils within the Newton-Wellesley Hospital Community Collaborative. These councils strive to make compelling impact in all areas related to overall health and well-being. These include domestic and sexual abuse, elder care, heart health and wellness, maternity care, palliative care, youth mental health, substance use, and workforce development. Please feel free to visit the Newton-Wellesley Hospital website at www.nwh.org to learn more or to get involved. In addition, the community programs we offer are also listed on our website and are continuously updated, so please check those regularly. We look forward to seeing you at many of our future events. Before the program begins, I would like to mention a few logistics for the next hour. We will be leaving plenty of time for questions and answers and would ask that you use the Q&A feature at the bottom of the screen to type your questions in. I will monitor these questions and being asked them of our presenter at the end of the speaking portion of the program. I am now going to let our presenter do most of her self-introduction, but I do want to mention a few things. Julie Norstrid, through her work, she has gained extensive experience and expertise in the area of aging, including the physical, emotional, and cognitive changes that occur in old age in the context of today's economic and social environment. Julie has worked in the aging field for the last 20 years, and we are so pleased that she will be joining us to share her expertise and knowledge this afternoon. And so now I'd like to turn it over to Julie.
Hi, Lauren. Thank you so much for inviting me to this, what I think is a very important topic. My goal today will be to talk about the concept aging in place. And it's a term that you probably have already heard about. And typically people thinking of aging in place, they'll think about it as in their own home and wanting to stay there for as long as possible. And aging in place is generally what people want. Indeed, a survey done back in 2021 by AARP found that approximately 77% of people aged 50 and over indicated that they want to age in their own home for as long as possible. And other surveys have indicated even higher percentages when you look at older people. Ultimately, aging in place is a really important topic for all of us as we age. But it is, I would say, it is important to also acknowledge that aging in the home that you may have lived in for 30, 40 years, or even longer may not always be the best option. For example, if you're living on your own, then it might be a better option to be living in a place where you are with other people to give you an opportunity for socializing. Also, for some people, they don't want to continue living in their own home. However, for others, they certainly want this. And as I indicated just a moment ago, this is what the vast majority of us want. And it really is so understandable because the environment, the neighborhood, the community in which we have lived is something that we're familiar with, and we have emotional connections with it.
Julie, I'm sorry to interrupt. I am imagining we're supposed to be, the slides are supposed to be advancing and they're not. We're still on your cover slide. So,
Okay.
so I'm just wondering if you can click and then click again. There we go. Yep.
Okay, so let me go back to, can you see aging in place, your optimal
Yes,
living
so
options?
perhaps you want to still be on there. I'm sorry to interrupt.
Yep.
Okay,
No, that's fine.
perfect.
The key thing about this, as you're reflecting on where you want to age, is to really give yourself time to reflect on all the different options and then to put a plan in place to make sure that this can happen. So as we go through this presentation, I'm going to be giving you some guiding posts in terms of how to think about whether should you stay in your own home for as long as possible, or should you consider other options? As Lauren indicated, I was going to do a little introduction about myself. So my background is in both clinical psychology as well as social work. I earned my MSW and PhD from Boston College, a pretty local place. And as part of my dissertation, I examined the environment in terms of both the physical and the emotional dimensions. And overall, the findings were quite clear that for older adults living in the community, if they feel that they belong to the community, that they feel that they can trust their neighbors, and that they are engaged in their community, then they're most likely going to report better physical and emotional functioning. So really where we live is incredibly important for our well-being. And after getting my PhD, I went on to teach at Regis College's social work program. But throughout this time, I've always labeled myself as a gerontologist. And that is because much of the work that I've done has focused on older people. For example, the courses I've taught, as well as the research that I've done, the boards for which I have served, including Newton's Council on Aging. And then over the last 6 years, I have worked as an elder care consultant for my company called Help My Aging Parents, as well as running caregiver support groups. And it's through this experience that I have gained so much understanding of not only the experience for older people, but also for the caregivers. Ultimately, my mission is to really help people maximize the quality of their lives by giving them a meaningful and safe environment to grow in. And that is what aging in place is really all about. So when you first came in, there was this warm-up question. What does aging in place mean to you? And when I'm reviewing some of the answers, which thank you very much for doing that, one person indicated staying in my home where I've lived for over 50 years. Another person indicated aging in place means staying in my present home with some supports as needed. Another person indicated my parents in their 80s want to age in place. I'm attending this webinar to learn more about what they need to consider. Excellent. And then one last one is more care, more supports, and it's new to us. So thank you so much. There were some other responses, but just for the sake of time, I'm going to move on. But ultimately, the sense that I'm getting from a lot of these responses is that the way people tend to think of aging in place is their home and the immediate environment in which they live, which is why, as you're thinking about this concept, I want you to start thinking about your home and then entail the things that I'm talking to you about into that frame of your home. So for the rest of our time, what I'm going to be focusing on is firstly, just the official definition of aging in place. And you'll see that it is closely tied with how you would define aging in place. Then some steps to think about when you're planning for your optimal aging in place. The supports that are available within your environment, your community, and what I'm specifically referring to is the home and community-based services. And then finally, I'm going to give you some sense of what some alternative options might be when it comes to aging in place. So not just your home, but other places that you might consider living. So the official definition of aging in place is basically, as what many of you indicated, this idea of remaining in your home safely, independently, and comfortably, regardless of your age, income, or ability level. Another definition, which one that I actually personally very much like, and that is by the National Association of Home Builders. Their definition is the pleasure of living in a familiar environment throughout one's maturing years, and the ability to enjoy the familiar daily rituals and the special events that enrich all our lives. It means the reassurance of being able to call a house a home for as long as possible. And the reason why I really like the National Association of Home Builders definition is because of their emphasis on this idea of ability to enjoy the familiar daily rituals, as well as this idea of enriching all our lives. Fundamentally, where we live is where we spend time. And ideally, our time is meaningful. The key point about the concept of aging in place is that there are many things to consider. And to do this most successfully, we need to put some careful consideration and planning into where we want to age in place. And I very much hope that this presentation will start you on that journey. So first, what I'm going to be addressing is things to consider, assuming you want to remain in your own home. And as I pointed out earlier, the vast majority of people do want that. And a good starting place is really to think about the home in which you want to remain in. Is it safe and is it accessible? And that's important because especially as you become older and you may experience some mobility limitations, then of course access and that sense of safety is really critical. And for many homes, this may well require looking into modifications that can make your home more age-friendly. And just some examples that you could think of is this idea of changing doorknobs to door handles, raising a toilet seat, setting up an outdoor ramp, and also, very importantly, any tripping hazards that may be making the likelihood of you having a potential fall, really to make sure that you remove those as absolutely as much as possible. One excellent guide that you can go to is AARP's Home Fit Guide. And this is a wonderful guide. It provides a very detailed assessment, room by room, about things that you need to look out for that can make your home safer and more comfortable. A more brief version of this guide is the Home Safety Checklist. Now, on this slide, I realize you can't see the writing, but basically it's just to give you an idea of what this checklist looks like. And let me just give a run through this quite quickly. So it makes you go through the home section by section. So just as an example, looking at the floors, as I mentioned just a moment ago, making sure that any tripping hazards at the exterior entrances or inside the house, such as throw rugs, for example, are removed. In terms of the stairs, the question that it has in that section is, could handrails be installed on both sides of the staircase? In terms of the bathroom, are there any grab bars near toilets and in the tub or shower? In the kitchen, the question is, are there safety knobs and an automatic shut-off switch on the stove? And outdoors, the question is, if a walker or wheelchair is needed, can the entrances to the house be modified, such as by putting in a ramp? Now, I will say that I have certainly done this with my own home, and it is quite an interesting exercise to assess your home through the lens of making it more age-friendly. And I have to say, I've already seen quite a few things that I realize my husband and I are going to have to modify. Just as an example, our stairways coming down to the first floor these are wooden stairs, and they are slippery. And we've already had one or two near accidents. Also, we have door knobs. And when you've been out walking, let's say, and it's icy cold and your fingers are completely frozen, trying to turn those doorknobs is practically impossible. Also, in regards to our home, when we first moved in, there was already a grab bar. And I must admit, my reaction was a little bit like, we don't really need that. However, I will say that I have already twice, at least, in my recent recollection, had to grab onto that bar in the shower because a soap bar fell on the ground and I didn't realize, and I had a near fall. So bottom line, the thing to realize is that these modifications that can be done can really benefit you from much younger ages. So the key point is to, when you're thinking about this idea of making modifications in your home, to not be too turned off by this idea of, oh my gosh, this is only because I'm getting old. The key thing is that you really want to make it as safe and as comfortable as possible so that you can age in that home for absolutely as long as possible, and ultimately having, being able to delay the need to go into an assisted or nursing home, which we all know is far more expensive. In terms of getting expert help with modifications, you can turn to what is called a certified aging in place specialist. And this is actually a program that was set up by AARP and the National Association of Home Builders. And these are experts that can come into your home and they'll do an assessment of what they recommend in terms of what modifications should be done to make your home more age friendly. And then you can decide whichever of those recommendations to act upon. Generally, the assessment is for free and is, as I said, is really up to you to make the decision as to what changes you want to make. And these modifications can be really as simple and inexpensive as making sure that you're removing any tripping hazards, to much more expensive, such as getting a stair lift set up in your home. And in order to help you with affording to pay for these modifications, there is, and you should look into this, a home modification loan program here in Massachusetts. And it's set up in such a way that you can get loans up to $50,000. And it's structured in such a way that it's a 0% interest that you pay, ultimately no interest. No monthly payments are required. It's only when you decide to sell the property or have it transferred, that is when payments are required. So please take the initiative and look into these two types of programs that can help you along in this process. But of course, initially, I would recommend that you just take a look at this home safety checklist so that you yourself can at least get a sense of what are some modifications to possibly think about. And what other things should you consider if your aim is to remain in your own home? I would say that firstly, think about the area in which you live and think about it in terms of, does it provide the services and resources that you will likely need going forward? And you can look at these services and resources in sort of the more practical domains. And that will often involve a lot of services around healthcare, such as doctors, specialists, home care services. And on the next slide, I will be talking in more depth about home and community-based services that can support you as you age in your own home. The other area to really think about carefully is, does my community, does the area in which I want to remain living, does it meet my social needs? Such as, do I have relatively easy access to family or friends? And I say this only because we all had a sense of what it was like to feel isolated, lonely during the COVID pandemic. And we probably, many of us, felt that sense of how it impacted us negatively in terms of our emotional well-being as well as physical well-being. And especially as you get older, you're probably going to stay closer within your community, within your home. So you want to make sure that your own social and emotional needs are being met. So certainly the resources around the practical issues are definitely important, but again, also the social needs do need to be considered. Then there's also the thinking that you should be doing around what happens when you no longer feel comfortable driving. And this is really important to think about because we here in America are very reliant on our cars. They enable us to get to family, they enable us to get to our resources and the services that we need. So what do we do when we can no longer drive or no longer feel comfortable driving? And that is where I really encourage you to think about what are some options that might be available within your community in regards to public transportation. And here, what I've found is that going to your local senior center or your council on aging, you can often get some great advice or some information about public transportation options. And just a case in point, here in Newton, we have had the NUMO program, which I will say I only just saw it this morning. Going forward from in July, it's actually not going to be called the NUMO program. It's going to be known as the Go Newton. But the key thing about this program, it's a wonderful program. It's available to older adults 6 and older, as well as people with living with disabilities and people on public assistance. And it gives you the opportunity to schedule your own ride from your phone app. And then it enables you to travel anywhere within, let's say, Newton, and to select medical destinations. And here in Newton, that car ride is $3. If you want to look at additional options, then look into maybe other nonprofit organizations that may have volunteers that can help you take places. And then, of course, think about maybe whether your neighbors, your friends might be able to help out in this area. But it is really important, and I really do encourage you to at least give it some thought about what options are available for you once you feel that you do not want to continue driving. Finally, what use should you think about in terms of technology? And technology, as we all realize, is coming more and more into our lives. But I would say that there is a lot out there that can really improve the quality of life for older people and their caregivers. And when I think about technology, I think of it in a very expansive way, ranging from hearing aids, medical alert systems, stair lifts, adjustable beds. And then, of course, you also have the technologies that can make your home smarter. And a smart home, which is a term that some of you may well have heard, is basically a house that's equipped with smart appliances and other devices with the goal to make your home more manageable and safe. And just some examples around appliances that would enable your home to be a more smart home includes devices that can control the lighting, can control stoves and ovens, door locks, alarms, and security cameras. And in actual fact, just yesterday, I attended the Alzheimer's Foundation of America Educating America tour. And the focus was on dementias and what we can do to help individuals and their families with loved ones who have some form of dementia. And one of the areas that they really talked about was making a home more age-friendly and dementia-friendly. And if you're interested, you should go on the website for AFA, Alzheimer's Foundation of America. Go on their website and look up the apartment. And that gives you a video of all the different things that you could consider in order to make a home safer. And in that video, there's plenty of technology. It's quite a fascinating video. So I would encourage you to take a look at that. Now, of course, we hope that family and possibly friends and neighbors can provide support when things become more challenging. However, few can rely on this help solely. Instead, many of us make use of home and community-based services. And these services are, just as you would expect, services that are within your community. And here on this slide, you see some examples of typical resources and services that people will make use of if they want to remain in their own home for as long as possible. And they include, for example, home care, which will help with just light house duties and possibly with some daily activities. There's home health aides that focus more on the health-related issues, companion services, meal programs, and then also there's the adult day services and adult day health services. And I just want to say a quick thing about this last one, adult day services. I have found that quite a few families do not know about this community-based resource. Basically, it is that if, let's say, you're a caregiver and you're caring for maybe your spouse, or maybe you're caring for an older parent, and you need a bit of a break, some respite, then this adult day service programs is a wonderful opportunity where you can bring your loved one to this place, and they will provide lots of activities, socialization. They'll also provide meals, and it gives you a break as your loved one is at this place for several hours, generally from around 8 or 9 o'clock till about 2 or 3 in the afternoon. and they're relatively inexpensive compared to residential settings. It's also really important, especially early on, when you're trying to figure out, well, what really is available to me, is to reach out to the aging network. And what I mean by the aging network is, for example, your senior center is part of the aging network. Your council on aging is part of the aging network. And then the aging service access point. Here in Newton, we have our wonderful senior center that has recently been renamed as the Cooper Center for Active Living. And then the aging service access point that we have that serves Newton is called Springwell. And all of these different entities are really wonderful resources in terms of just getting information and possibly getting services. So if you're not familiar with these aging network entities, I really encourage you at least just go on their websites and start to look at all the different information and resources that they have. And you'll find that when you call, if you're unsure about something, they are more than helpful and willing to help you try and steer you in the right direction. Just as an example, here in Newton, the senior center here, we have the Friendly Visitors Program. We have help with shopping and transportation. We also have help with any legal questions, paying bills, and other financial matters. That is just a tiny description of all the help that they can provide. But again, please look at these different entities, because as I always say, the more you know upfront, the more you can really help yourself as you move forward once you have much more information. For those of you who may not know where these different entities are, you can go to the Elder Care Locator. This is a nationwide website where you put in your zip code, and it will give you the nearest aging network services within that zip code area. We are lucky in that we live in a fairly urbanized area, such as Newton and close by. So probably for us to access one of these entities, it doesn't require having to go too far. But the Elder Care Locator is, like I said, nationwide. So wherever you live in the United States, you can put in your zip code and find out what is within that area. One last thing I will say is that I think many of you on this call are probably aware that the cost of long-term care is pretty high, but we may not really know what we're dealing with, which is why the Genworth Cost of Care Survey is a really excellent survey. It again, you pull up the website, you put in your zip code, and it will give you the cost by month or by year for different types of long-term care services, such as maybe a home care service, an aide that comes into your house, or what the cost would be if you're going to live in assisted living, what the cost might be if you decide to go into nursing home. As I often say, you might need a stiff drink when you look at these numbers, but it's much better to know what you're dealing with than to be shocked later on down the line. And again, it really makes you want to try and make sure that where you're living is as safe and as comfortable as possible, so that you can delay the use of long-term care services as much as possible. So based on what I've said thus far, the fundamental starting point on your planning for optimal aging is that you need to ask yourself this: is my current living situation the optimal one for me? And what I would say is that what I found when working with families is that the question really starts to come up when you're dealing with, let's say, an older parent who's living by themselves. Maybe they become recently widowed, or if they are becoming significantly more challenged in terms of their own health, their mobility, possibly that they're finding that the house, maintaining of the home is becoming unmanageable. And then finally, what I've also found is that some people start to just feel unsafe and uncomfortable living in their own home. And they then start to really think about possibly the home that I've lived in for this many years may no longer be the best option for me. So I really want you to realize that there are many other options out there. And on this slide here, you see sort of two categories of lists. And I've organized them in such a way that this top one is more around settings that provide minimal assistance. And for example, you got something called the accessory dwelling units. Some people call it the in-law or mother-in-law unit, secondary dwelling unit, granny flat, or carriage house. But the official name is ADUs, accessory dwelling units. And in Massachusetts, you have laws about who can and cannot set up an ADU. It's all about the size of your lot. And if you're living in Newton, you can look up this www.newtonadu.com, put in your address, and that will tell you whether you can actually consider setting up an accessory dwelling unit. I have dealt with some families where the adult children want to bring in a loved one from another state, and they are then thinking about setting up an accessory dwelling unit so that their loved one can live right next to them. Other options include living with your family, which I will say there are certainly pros and cons around that. Not everyone has the setup, not everyone has the family dynamics where that is the optimal decision. However, I will say this idea of multi-generational living is becoming a thing that's more common here in the United States. And looking at it from a socialization point of view and the ease of having people living under the same roof, there are certainly advantages about considering the idea of living with family. The other area that people have looked into is independent living. Others call it 55 plus communities. Now, these generally, there's a whole range in terms of the kinds of services they provide and the level of luxury, let's put it that way. Some of them require that you provide an initial deposit, a down payment, as well as monthly payments. So independent living can be quite pricey. But again, the immense advantage that they have is that they provide a lot of services so that you no longer need to worry about maintaining the home, doing your own cooking, your washing, things like that. In terms of options that are more cost effective, there's subsidized housing, co-housing, house sharing. And then there is what is known as the village model. The first one started here in Boston called the Beacon Hill Village. And here in Newton, we have what's known as Newton at Home. And this is a sort of a geographic area where you will pay a monthly fee, and then you get assistance around different types of services that you could look into. You may get some help with transportation, but it's a wonderful sort of setup where neighbors help each other. when you get to a point where you're starting to feel that you do need more assistance, then here are the options when it comes to living options that provide greater assistance. Some of you may have heard of what's known as CCRCs, or continuing care retirement communities. And basically what these are is they provide care. So it's a range of services right from starting at independent living, right through all the way through to nursing home or memory care. The advantage is that you stay in the same geographic areas. You don't have to worry about moving. CCRCs are very expensive, but certainly also very nice. I do remember about 5 or so years ago visiting my first one, and I remember calling my husband saying, I think I want to stay here. They have lots of services and wellness programs, but they are very, very expensive. Typically, what happens is when someone and they're living it in their own home, and they get to a point when they really do need much more help, and they do need to, that living at home is just no longer an option, even with care from the family. Typically, people will move into an assisted living setting. And there you get some help with some basic activities of daily living, such as showering, bathing, dressing, feeding, and so on. And then as your level of need for care increases, then you are possibly looking at nursing home or memory care. And there are a lot more memory care options here in our area. The final thing I want to talk about is the PACE program. And the PACE program is something that I've found that a lot of people don't know about. And PACE stands for Program of All-Inclusive Care for the Elderly. And it's administered by both Mass Health and Medicare. And what is really amazing about this program is that it provides a whole range of services, from medical, social, recreational, and wellness services, that the goal is to enable that individual to continue staying in their own home for absolutely as long as possible. And also, I've heard from these PACE workers that they also sometimes are able to get people out of nursing homes into a PACE program. In order to qualify, you must be dual eligible, meaning that you are eligible for both Medicare and Mass Health. You must be nursing home eligible, and you must be able to live safely in your own home with these supports. And generally, the PACE program is something that's it's available in 32 states. And it does, for example, there is a PACE program near here that does cover Newton. But it is important that I point this out because that PACE program, I think there's 3 of them in Massachusetts. They don't cover all parts of Massachusetts. So you would need to go onto their website to double check that your specific town is covered by the PACE program. But what I like about this is that for some people who are just financially in dire straits, they can turn to this program and get help. Now, when it comes to thinking about these alternative options for where to live, I want you to realize that when you're trying to think about, well, what would be my optimal place to live, that it's not just about what is the place that can give me resources, but it's also critically about what place will give me that continued socialization. And especially as we get older and we become more, our community becomes smaller and smaller. it is critical that we have support, whether it be paid or family support, nearby that can really help us, and also to give us that sense of emotional well-being. The key thing is by having regular company that can really support your emotional and social needs as you age. And that is why for some families, when I've worked with them, I'll sense as a tremendous hesitation by the children, let's say, the adult children, about having mom or dad go into independent or assisted living. And what I try to emphasize there is that if they could think about it from what that place could give their loved one in terms of socialization, then it becomes a different dynamic. Because sometimes with these families, what they have found is that their loved one, who may have been feeling actually quite isolated, livens up and is much happier in these kind of settings. But bottom line, as I have been talking, I have given you an array of different things to think about, whether you're going to be staying in your own home for as long as possible, as well as other options if you decide that you want to move to another place. The key thing is that I cannot stress enough is that you really give it some time to reflect on this. Talk to your peers, talk to experts in the field, maybe talk to your primary care physician who might be able to give you a sense of what you should expect in terms of your own health. And really start doing your homework. Find out what the aging network, your councils on aging, senior center, your aging service access point, what they can give you in terms of just general information and what kind of services they provide. That will give you a sense of, okay, these are my options. This is what I want. And that will help you to sort of get you to a better decision around where you want to live. Because as I've emphasized several times now, where you live really matters. One last thing I want to say before I take questions is, if you're very interested in this topic of where you want to live, you can go to this website called ECDOL, which stands for Excellent Care, Decency, and Optimal Living. It's a website, and there I have 2 articles on this very topic titled Late Adulthood Options and Guides for Choosing Where to Live. So you can get some more in-depth information on top of what I've been talking to you about today. Thank you so much.
Julie, thank you so much. That was so much content, good information. We really appreciate that. So we will now begin the question and answer portion of the program. So I actually have a number of questions that have come in that I'm going to ask of Julie. And then, as you can certainly add those into the Q&A, and I'll continue to monitor those. So the first, and I think it touches on 2 different things. And again, there's going to be 3 other parts of this series. So we'll be able to respond to these questions, but then also know that Julie will be going into more depth into some of these aspects in subsequent sessions. But this first question, Julie, was from an individual who is an only child, and they are caring for their 90-plus-year-old parent who is living with them. And this parent is refusing to go to a nursing home. Money is not an issue, so it would be possible. And this particular child / caregiver is exhausted. And so I think this touches on 2 things, is that one, when you have a parent or someone in your life or your network that does not want to change their living situation. And then the second being also attention to the caregiver and what that means in terms of taxing and burnout, and the effects on that person. So maybe however you would like to respond to that.
Absolutely. No, it's a statement and a concern that I hear in so many families, where the loved one who clearly does need more support than you can give, is refusing to move to either assisted or nursing home. What I find is that sometimes by going to various events at these places, especially assisted living events, or assisted living places, they will have various events that you can take part in, and you can get a sense of the environment. And so it gives that the individual a chance to just get a sense of what it looks like. You don't have to say that this is where we're thinking of having you say, but just to say, let's let's go to this assisted living or nursing home, and let's just have something, a bite to eat, or go to an event that they've organized. So they get to start to see what it actually looks like, because I think for some people, they have maybe a misconception of what it might be like to be in an assisted living or a nursing home. The other point is also that it really is something that you have to pay attention to as a caregiver, because as the individual who asked the question, it sounds like she's getting to a point where she's burning out. And it's only so much longer that she can continue providing this support. And so he or she also needs to look into their own well-being, how much longer they can sustain this. And the last thing that you really need to think about is getting your loved ones signed up, because some of these places can have a waiting list, especially the ones that are more desired.
Great. Thank you so much. That was great. And I think another question came in and also speaks to some different aspects as well that I think is important and maybe on people's minds is how does one access resources and support/services given the shortage of labor? So I think that that's two pieces, is that one, kind of the accessibility and even knowing where to go. And I think you've spoke to that today, somewhat in terms of just choices and, going to your councils on aging and other resources that you've shared. But then also, is there any impact? And I think there is some in terms of the shortage of labor in the overall market period, but also within healthcare.
And that is definitely a growing concern, is that even for families that can afford this paid help, they are struggling with finding help. And which is why I encourage people who are looking into whether it's paid help or possibly getting a family member to help out, is to think through in terms of exactly. So basically, think through the questions that you're going to ask when you do this initial sort of assessment of an agency in terms of the quality of the aids that they can provide. So that because what I found is that people will call up an agency and just take whatever's available. And then inevitably they'll have to go through maybe 2 or maybe 3 agencies before they really land on one that provides suitable aids. But with that said, I realize we because of the limited workforce that is available, sometimes we just have to work with what is there. And which is why you may need to consider really taking some time and helping that new aide to really walk them through what are your expectations, what are the needs of the individual that is needing the care, how do they like to be provided care for, so that you really make it the best possible, give that aide the best possible chance of making it work out. So it will require some thinking through about what works for you, what works for your loved one. And then when you get that aid, work with them, help them, make them as successful as possible.
That's great. That's great. And another question, and I'm going to have this be the last question because we're almost at time, and I just want to make some comments at the end. Someone did ask, when you say you work with people in this field, what does that mean? If you could just share maybe a little bit.
Sure. So, I mean, it really is about people who come to me, whether it be the older adult themselves or the adult children. They'll often come to me with that sense of something needs to be done. Maybe from the perspective of the child, they're becoming increasingly concerned about the parent, or possibly a spouse that's becoming more concerned about their loved one, their spouse. And I help them to really walk through all the things that they consider, that they should consider. So not only the housing options, the living options, but also in terms of getting all your affairs in order, making sure that you really know the health conditions, you know the medication that your loved one that's supporting you, your adult children, also understand your health situation. Transportation. So I really look at it from a very sort of holistic perspective to try and make sure that families have considered as much as possible all the elements that they should think about in order to ensure that their older loved one can age safely, no matter where they may be.
Excellent. Thank you. So this is great. This was fantastic, and we really want to thank Julie for being with us. And I know and hopefully all of you are looking forward to the other sessions that are coming. As I mentioned at the beginning, our next session is next Thursday, June 20th. And if you haven't registered for that one, you can do that on our website as you did for this one. And then there will be 2 in September as well. So you can do all of them if you would like, or do them in piecemeal, whichever works for you. And please share that with your families and friends and neighbors and such. Many of you have asked, which is a good sign. We will be sharing this recording, which will include obviously all the slide content as well, after this session. And so everyone that has attended will receive that in the coming week. So look out for that email that will come from the collaborative or myself. I'm not sure which one. And then a reminder to visit the website for registration of the other sessions, as well as other programming that we have there. And again, I really want to thank you all for joining us this afternoon and spending your kind of lunch hour with us. And we hope to see you next Thursday as well. And then lastly, within those slides is also the resources that Julie has shared with us, but then also her information for Help My Aging Parent. So a number of you in the question and answer had asked how to do some follow-up. And so that is available as well. So thank you again, and I hope you have a good rest of the afternoon. Thank you.
Thank you. Bye-bye.
Bye.